So the three different layers of this on your paper. So make a triangle. Okay. The base layer is new patient level. And what I'll say there is this is where there's actually a level underneath that too. It's what I'll call the web presence level. If you don't have web presence, you need web presence. We can help with that. But that's I'm assuming this first level, this new patient level, is you actually have some type of web presence. So there's kind of a sub level to that. If you don't have it, you need it. So the first base layer, let's say if you have that web presence level, this first layer is new patient level. What I mean by that is that the average doctor has gaps in their schedule. They might have a 5 to 7, 10 new patients a month, but they really need 1 to 2 new patients per single day on average. So if they're working 16 workday months, the average single doctor can handle 16 to 20 or 16 to 32 new patients in a month. That's where 99.9% of all doctors start with us because they have some gaps. That's what's encouraging them to call us. So that's base layer number one. Then if a doctor gets full, so let's say if they have, we could help them with this, or they currently get to a place where they don't have any more new patient need, meaning they're full. I'll meet a doctor at a convention. They go, I don't need any more new patients. I have enough new patients. Then I'll say, hey, are those new patients fee for service new patients? And they go, well, no, they're not. Or they're not enough. I want more of those. Well, my next question is saying, do you want, if you're full on new patients, then it might be the next level of where you are ready to graduate into the next level. And the next level is what we call the payer mix level. The payer mix level is the second true level of really practice growth. Okay. And that level is when you figure out, okay, I'm full with my new patients. Don't stop with your new patients, doctor. If that's you, if you're full on new patients, you don't have any more room in the inn, but you have PPOs and you are part of 2, 3, 4, God forbid, 16, 18, 20 PPOs. We can help with all that. But is it if you are, then you're now reached this next level. So don't cut back on your marketing. You might need to focus on marketing to remain in this second layer. But the second layer now is payer mix. Why is that? Well, the first layer is increasing new patient numbers. Second layer is increasing profitability. Profitability is your friend. If you don't have it right now because you're one of the average doctors out there that is, let's say, a $1.4 million. Every time I talk to you, I'm talking to you as a single doctor. Okay. So if you're a two doctor practice, 2.8 million production, and you're a 2 million collection, or a single doctor, 1.4 million production, 1 million collection, you're writing off $400,000 a year. Now, most of these doctors call us up, Jim, and say, I don't need marketing. I've never marketed before. And I ask them, so then you're 100% fee for service. They go, no, I have PPOs. I said, oh, you do PPO marketing? And they go, I've never really looked at it that way. And
There
the
you
reason
go.
why that got it that way, right, is because just like when, you know, the Vegas, when they put you up, I won't mention any names, any hotels, but when they put you up in a suite and you feel really good about it, right? And but then you go down and you lose all your money downstairs and you're having a quote unquote good time.
Mm.
But you walk away absolutely broke. For some reason you go back, right? But that's a PPO right there, right? For some reason you're okay going month in, month out. That practice that I just quoted you is actually the average single doctor practice is writing off $400,000 a year. You then put that down on paper, Jim. It's actually $33,000 a month that they're writing off. But that's where their brain goes, oh, those are the write-offs. Those aren't just write-offs. That's $33,000 a month in marketing for PPO patients that are not really wanting to get this. Let's say the doctor is here clinically. The patients should be here from a standpoint of wanting to get healthy, but they're actually here. They're really not wanting a clinical, excellent partner in their corner. They're just wanting cleaning every once in a while and maybe occasional filling or two surface composite or a occasional crown that they think that the insurance can't cover because it probably won't because your full schedule is at 1,400 and you're probably only going to get 1,000. But all to say is that that practice that is clinically here does not have the right type of patient. So therefore, they're investing $33,000 a month in marketing. One of the greatest marketers I'll ever meet, and quite frankly, that's the average doctor that starts with us. As far as saying that's what they're writing off every month, that they've never looked at that.